hydrogen, helium, lithium, beryllium, boron, carbon, nitrogen, oxygen. This is an element in periodic table, and apart from making lithium batteries, it is used for psychiatric illnesses. Isn't that amazing? So welcome back to Not So Complicated. We will be talking about this lithium therapy and toxicity in detail today. So lithium is a first-line mood stabilizer for bipolar disorder, especially in maniac episodes and maintenance therapy. So it works impacting in brain structure like neuroplasticity, neurotransmitter modulation, and intracellular changes. So let's talk about how does it work in detail. So what actually happens is that lithium inhibits inositol monophosphatase enzyme, IMPase enzyme, depleting inositol triphosphate, right? And this depletion of inositol triphosphate leads to the dampening of overactive second messenger systems. Example is in mania. This is what happens in mania. And also, it competes with sodium, potassium, and calcium ions, stabilizing neuronal membrane excitability and reducing maniac hyperactivity. So this is the major way that it works. And the other thing that, like other mechanism that lithium works is that it upregulates BDNF, that is brain-derived neurotrophic factor, by inhibiting GSK3. Like GSK3, that is glycogen synthase kinase 3, is an enzyme that is used in metabolism of BDNF. So inhibiting GSK3 like leads to the increased level of BDNF, and BDNF is normally used in neuroplasticity to our brain. So that is how it promotes neurosurvival and mood stability and also neuroplasticity. So the other way it works is that it increases serotonin signaling, contributing to antidepressive effects. So the uses of lithium is in bipolar disorder. It is the most effective mood stabilizer. And then unipolar depression, it is used in combination with antidepressants like sertraline, escitalopram, citalopram, right? And suicide and aggressivity, it reduces the risk of suicide. In all antipsychiatric drugs, this has the highest like factor of anti-suicidal feeling and aggressivity, right? So then the other conditions used are hyperthyroidism. It is actually used, the side effect of lithium is hypothyroidism. We will be talking about that. So hyperthyroidism, it can be used. Seborrheic dermatitis, herpes simplex, hematologic conditions, and neuroprotective effects. It could prevent dementia. Out of all these things, it does not work in normal patients. It works only in diseased patients. So neuroplasticity cannot be increased in a normal patients using lithium. So it will lead to lithium toxicity actually. Other mental health conditions is schizophrenia, pathological gambling, and OCD, that is obsessive compulsive disorder. Lithium can be used very well. And in lithium toxicity, what actually happens in lithium toxicity? There is a mnemonics, a famous mnemonics, that is lithium itself, and Li is leukocytes increase, that is leukocytosis happens in lithium toxicity. And then T is tremors. It is the most common side effect, that is tremors. And then hypothyroidism, I have told about it earlier, why hyperthyroidism has a use of lithium because of this side effect obviously. And IU is increased urination. It causes lithium induced nephrogenic diabetes insipidus, and the drug of choice to treat this symptom is amiloride. And M is avoid in expectant mothers. We have to avoid lithium in expectant mothers who are about to become pregnant because it has a very high risk of Upstern anomaly. Upstern anomaly is the formation of tricuspid valve in heart is not done. Like fibrosis happens or agenesis happens in that region. So it has a difference with valproate and antipsychotics. But before that, let me tell you something, that lithium should not be used with thiazides because thiazides has a high tendency to reabsorb lithium from tubular lumen, right? So that is how lithium toxicity can be exaggerated, so it cannot be used with thiazide diuretics. So difference with valproate and antipsychotics: valproate enhances GABA and blocks sodium channels, better for mixed episode. This is just a clinical parlor additional information for you, and we'll be talking about this in detail in our upcoming videos obviously. So antipsychotics like olanzapine block dopamine, targeting psychosis, right? So this is all about lithium therapy and efficacy and toxicity and all of that. Subscribe for more clinical polls, and thank you for staying with me. Thank you.